boy that had a perianal abscess that was very, very deep in a home that was filthy. He had a Child Protective Service case open. I had to do his wound care in a room. He didn't have a bed. He had a mattress. There were dogs and cats everywhere. I had to go in there, double gown, triple glove, mask. Eddie Mercado taught me everything I know about wound care, especially in the home setting. Keep everything clean. Sit down on the floor and vac that sucker. And try to vac that. That would take me an hour and a half to vac. I would get a seal. Then I had to put a bunch of stoma adhesive to make sure I got a seal. I would get a seal. Later I told the doctor, I said, this is a fistula. The baby would heal and reopen, heal and reopen, heal and reopen. This is a fistula, no more vac for this patient. I told the doctor that. I'm the one doing the wound vac. I'm the one touching the wound. I'm a nurse. I'm the one that does the wound care. That is the difference. I think that's why we have such a great success rate with our patients, because I'm like, I will debride with my hands. I can't get paid for it, but does it matter? Sometimes you need to just debride with your fingers because you just need to take off the top layers of the skin. Oh, but I can't debride. I can't get paid for that, right? Because I'm not using a sharp. Sometimes you can debride that way. Okay, sometimes you can't debride for the first 3 weeks because the skin is so black, dry, and hard that if you debride too much, you're gonna go all the way to the bone. Easy does it. Put a little enzymatic debrider, lift the edges, cut the edge. A little bit more, lift the edges, cut the edge. Be patient. Yeah, I know you can't build that. It's not all about the money. The money is gonna come. I told you guys that when I started doing wound care, I would take 3 hours on a case, and I was like, Dr. Quintana, you lied to me. This is too much. This is too much work. There's no money in it. He's like, well, I think there's gonna be some money in it. There's money in wound care. There's a little bit of money in wound care. You do what's right. If you stop thinking about how much you can get paid for debriding, and how about you start working on healing patients out, so you heal them so fast that everybody's running to you and not to somebody else. They're running to you because, number one, you care. Another reason why we're so successful, we were here last night, I was so sick, and the guys were here with me, and we were downloading PDFs and calling everybody that was going to speak, and calling the vendors, and Colleen says that, hey, you're going to be here tomorrow, right? And I added another word that Mexicans use that I'm not going to say because I'm Mexican. But it wasn't a bad word, because in Spanish, they're not bad words. It's part of the language. It was like, my brother, are you coming tomorrow? So we were here and we were working, and I'm like, oh, we need to call this patient, make sure he's going to speak tomorrow, his testimonial. Can you look up his phone number? And then I look at my phone, and I have him on speed dial. And I look, and I have text from him. And then I'm like, hey, I have him on my phone. Call him, text him. Hey, you're going to be here tomorrow. He said no. Wife said yes, he's here today. Thank you.
That's how it works.
The other patient, can you call this patient? The number's disconnected. I'm texting her. Hey, did you change your number on Facebook? Oh, yeah, I changed my number. Here's my new number. Okay, y'all are here tomorrow? Mema's supposed to be here. I don't know if Mema's going to come, but he said he was going to come. He was probably having a little bit of trouble with transport. But it's so early. He's probably going to show up like at 1. And if he shows up, we'll do his patient testimonial. So then I thought, you know what, guys? There's so many reasons why I give patients my number. And by all means, guys, all of you watching on Facebook, I don't expect you to give everybody your number. It's very exhausting to be available all the time. I have learned in my life at this tender age of 43 that people are only going to give you what they have in them to give you. There's people that can barely manage what they're dealing with in their life, much less pour into you. They're so empty that they can't give you more. They need to, I love you, Lori. They need to take care of them, take care of their family, and that's where they go. That's how they can do, and that's okay. I've been blessed to not be that constricted, and so I have OCD, and if my patient can't get a hold of me to tell me they're trying to paint the wound with betadine, I'm going to have a heart attack when they come with painted betadine on a wound that wasn't indicated to get betadine. And then I'll call the nurse, hey, are you trying to put betadine? They're like, how does she know? And now in the community, they know, this is April's patient. Do not do that to her patient, because she's going to call you in a nice way, because I'm a nurse. I'm like, yeah, I'm a nurse too, but please don't do that to his wound, because the doctor's texting me, and she's sending me pictures that the wound is looking like this. So it is extremely exhausting to do it how we do it, but that's why it is productive, effective, and that's another reason why patients, they get encouraged, because we're telling them, you're going to heal, but I'm also going to be available to you and your family. That's exhausting. Why do I give the patient false hopes? I'm not giving them false hopes. Just because it hasn't been done until now doesn't mean that it's not going to be able to be done, because we're doing it. And we are revolutionizing. You guys are seeing, there's stuff that we are working on that I can't even believe that we're working on. And we're working on patents, and stuff is working. And wounds are healing with very inexpensive things that are already there. There's wound care products. And why you have to do some research. You have to call the FDA and find out why this product is no longer there. Who wants to do that? Nobody, right? There's no money in it. There's wound care products that are no longer being made that were around in 1970. Some of these wound care products were around in the early 1900s, and doctors were using them to heal wounds. But the FDA dropped the patent. They dropped the approval because the lab dropped the patent, because maybe that lab went out of business. And so that powder, that gel, that whatever is no longer available. And so I'm like, this is available in another country. And so we're finding things that are very inexpensive. And then we're getting the powders. And then recently the company that was making a certain powder said, April, there's no money in this. We're going to not make it. I'm like, there's no money in it. You're not going to make it. This is what's healing my patients. So that makes me get real creative and look at other stuff. And guys, we're taking this global. We are really revolutionizing the way we're doing wound care. I don't have to tell you. You could just look at our brochures. You could just see our testimonials. You could just ask the patients. We had a patient, and this is why we modify the way we do things. And we're always, I'm like, guys, and we call ourselves a wolf pack, right? I love it. We're a family, and we run like that. And I tell them, guys, we're going to have a meeting about this. We have so many meetings all the time, like almost on a daily basis. We'll do this, talk about this, and it's just amazing how quickly I change things in my office. You're out a day, we modified 3 things, and you're way behind when you come back. Like, what happened? We're not doing it like this. We're not doing it like that. Get used to moving with the cheese. And this is how wounds are. This is how patients, we're always improving our system. So, do you have time, or you want me to do your testimonial first real quick, and then I continue to lecture?
Sure.
We do your testimonial? We're going to pause my lecture because I have a patient testimonial, and he's very near and dear to my heart. And I'm going to finish the story of how patients come in and how they finish, because I want him to follow me. Yes, sir.
About
the bell. He wants you to say the bell because that means a lot to him, right? It means a lot to you too, right?
Yes.
Mr. Hernandez? Guys, I have a healing bell in my office, and I talked about this, and it's mine because I started the trend. And every single patient that we've healed out has rang the bell. Unless you didn't show up after you were healed and you didn't show up to ring it, even though I told you there's like 5 or 6 of y'all out there. Que no regresaron a sonar la campana, pero se sanaron. And so, every time a patient heals in my clinic, in our wound center, we ring a bell. And the other patients are like, ¿qué es eso? What is that? That's our healing bell. The patient healed, and so we ring a bell. They're like, oh, I want to ring that bell. And then they ring the bell. And so the transition, and it's so rewarding. And then they get a new wound, and they come straight to me, and then they ring the bell again. I'm like, you rang the bell 5 times. You just like to do this now, because they come much earlier, and they heal much faster. When you see a patient broken, and then you start seeing them walk a little bit straighter, then I'm like, okay, you could put a little bit of weight on that foot. I can walk a little bit on it, a little bit. They start walking. Then they come in, and I'm like, okay, you could put full weight. We're almost there. And then they start walking. And all of a sudden you see a gentleman that's driving again, that walks taller again. And I'm like, were you always this tall? But when you give somebody back who they are, we're all aging, guys. My grandma, anybody that does geriatrics understands this. And if you're too young, you still don't understand it. I always ask 20-year-olds, are you aware that you have knees? Now, there's 20-year-olds, and then there's 20-year-olds. Disclaimer. There's some 20-year-olds that have lived a lot, that have worked a lot, that have aches like a 30, 40-year-old. And then there's some 50-year-olds that have been very rested, and they have no aches, but they're having them now. Now, it does make a difference when you give somebody their personality back, when you give somebody their life back. My grandma is 87 years old. She has been a fighter. She helped me raise my 20-year-old son. I don't know if y'all saw him. He's 6 feet tall, wears a beard, big kid. I had him, breastfed him, very proud of that. That's my baby. Yes, I'm bragging. She helped me raise that little boy. Okay? I was always working. Do you think my grandmother wants to feel like she's losing her mind because she's got Alzheimer's and she can't drive? No, she doesn't. Mr. Guzman didn't want to stop driving. He didn't want to be told that he couldn't go here or there because he was going to crash. Mr. Hernandez didn't want to stop teaching as a coach. But he had to, not because of any doctor's fault, but just because of the way the wound progressed and it wasn't healing. But when you start saying, you can walk, you can this, you can bathe. You know how important it is to just wet your foot? I have a protocol. You don't wet my wounds. For those of you out there, don't wet my wounds. Don't wash my wounds with wound cleanser. Don't wash my wounds with Dakins. I have very strict protocols, and you don't wet your wounds. Why? Do you guys think that the water you bathe with is clean? Do we know that we have an agreement, the more you know, the more powerful you are. We have an agreement with Mexico regarding how much stuff we can dump into our water, right? And recently there was a newscast or whatever, a news story that said that they were violating their end. Well, I'm sure they're just dumping whatever into the Rio Grande River, and this is what we bathe with, right? So do you think the water has E. coli? What do you think? Like, that's why I always say, you know, degrees don't make you smart. Knowledge, wisdom. How do you attain more knowledge? You have to study more. You have to learn a lot of stuff. It takes a lot of work. It's exhausting to continue, to always be devouring knowledge, to always be going to school, to always be going to conferences and doing CEUs for the fun of it, to be a better clinician. It's going to be exhausting to do a clinical psychology degree, but that's where I'm at because my patients don't heal if their mind isn't well. So we have to help patients get a little bit better in their psyche. Not psychiatric, no estamos locos, psychology. Assistance in understanding how you feel, how you function, and how you can develop better coping mechanisms. When you give a person their life back, they're a completely different person. That is the case of Mr. Hernandez and his lovely wife and family. He's going to come and speak. Real quickly, we're going to put up his wound as well, and then I'm going to go back to tell you guys how to heal wounds. But it is about life, the quality of life. We're all, mi abuelita dice, donde te veo me vi, y donde me ves te verás. It's true. We're all heading that way. We got to give these people, as they start aging, the respect they deserve. You saw Mr. Nichols. What a breath of fresh air. He's like, you heard him tell you that he has basal cell carcinoma. He just told me that, and he told me in a very emotional way. I want to talk to you in private so you know my new diagnosis. He just wanted to make sure that I was going to be on board with him after he got that surgery so he can make sure his face was going to look as good as possible because he knows that we're going to heal his wound. And he knows we care. That man hasn't, did you hear him say that he hasn't worn a suit? That he developed the double chin since he last wore a suit? That man was a businessman. That man was CEO, administrative in a lot of very high, clearly you could hear by the way he expresses himself, right? And the way he carries himself. You don't think that just made his day that he's healed out, he's walking around and he's in his suit? You know, I'm 43, but in my mind, I can't believe I'm not 20. We have to remember that's why we do this. So people like Mr. Hernandez can go back to coaching. So people like Mr. Guzman can drive. So people like Mr. Nichols could walk around without shorts and those special socks. That's why we do this. And if that's not why you're doing this, you need to get out of healthcare. So we're going to let Mr. Hernandez talk about his story. And you're not the only one that gets emotional, Mr. Hernandez. But this is what I live. This is what I do. My career and my passion for what I do has cost me a lot. And it's been worth everything that it has cost me. I wouldn't do it any other way. So let's load up that and let's have Mr. Hernandez talk.